Welcome everyone. Good afternoon. I think it's afternoon wherever you are right now. So good afternoon everyone and welcome to another Fullscript webinar. Today you'll be hearing from Lee Carroll and Jen Franco from the Society of Wellness Nutritional Systems on the secret business of men's health. But before we get into that, we at Fullscript wanted to mention that we're very excited for this event as it's the first done in collaboration with the Society of Wellness Nutritional Systems. It's our newest education partner. So we're partnering together because we're aligned on a mission to help you through quality clinical education to become more confident and effective in your practice and to ultimately help your patients live a healthier, happier life. So we're very excited and we're looking forward to bringing you this presentation today and tons of future content we have planned in collaboration and hopefully many more webinars in the future. So I'm gonna thank Jen for being here today. And before we totally pass it over to you, I'm just going to let our attendees know that we will be recording this webinar. So you'll get a link to the registration or to the recording, sorry, after the event, as well as you'll probably notice, and Jen will speak more to it, but in your control panel or dashboard, you have some extra goodies, little handouts in there. So we'll be providing a little package of all of this to the registrants after the event, so you can go back, watch it at any time you'd like. It's available on Fullscript's website at fullscript.com/webinars, so you can always find everything there. And yeah, I think that's my little housekeeping. And again, thank you, Jen, for being here. We're so excited, so I'm gonna pass it over to you and we'll kind of get started.
Thank you so much, Kaylee. I appreciate you and that introduction. Thank you, everyone. Welcome. It is Thursday afternoon. I am joining you from San Diego, California, sunny San Diego, as we like to call it. This is where I have lived and had a practice over the last 15 years or so. And so this is a place that I love, I call home, and it's such a great honor when you get an opportunity to connect in this way wherever you are joining us from. So again, thank you for your time this afternoon. We're going to jump right on into a few slides here. What you guys see in my PowerPoint presentation here, the very first one, this is our website. So you guys are getting your introduction to me as Jen, who started this SOW, Society of Wellness. That's what SOW stands for, not SOW. It does not stand for anything pig related. That's something we get a lot of jokes about, but had I known, I would have probably abbreviated it differently. So Society of Wellness Nutritional Systems. And as a practitioner, I am in clinic. I'm seeing patients now very much virtually these days. But what I found myself doing was that I would spend my weekends out of town across the US, across the world, really doing quite extensive travel to learn the type of nutrition, the type of functional nutrition, the type of Western herbal medicine that I wanted to practice. And I had to go to these extensive lengths to go find the content to learn and practice from the colleagues or the professors and the teachers that I wanted to learn from. And so once, a few years ago, I was able to connect with some of these teachers of mine and said, hey, do you think you guys would be open to doing some online courses? Because quite honestly, not only is it costly for us to do travel, but it's quite a bit of time. Sometimes we have to take time away from practice to go to these conferences and symposiums and so on. So I was very fortunate to be able to get the ear of some of our professors and teachers, and they thought, hey, this is a good idea. So we started this segment of the company where it's all about online education. And I really want to stress to you guys that it's by practitioners for practitioners. It's not about me teaching the content, it's about the ones that I learn from, the educators, the experts in the field of everything that I practice. So that's where this really started, and that's where this nutritional systems idea really came from. So that's what you see. If you go to our website, this is what it looks like. That's how you know you're going to be in the right place. So with getting started for today, our topic is about the secret business of men's health. And what we found is that this was the theme. I think the theme for Fullscript for the month of April was hormones. And what we found is that we tend to lean a little bit more to the women, the female endocrine side of things when we do these themes like hormones. So we thought we would change it up a little bit for you guys today and talk about men's health, and in particular, benign prostatic hypertrophy. It's something that many men suffer from. Sometimes it's with symptoms, sometimes without. And I thought this would be really good to break it up because usually us women get a lot of the attention. So hopefully you guys are excited about that. Part of us presenting or bringing this content to you, and what you'll see if you guys are familiar with us or you've taken some of our courses, you will know that we are heavy on handouts. And what I mean heavy on handouts is that just for today, we've provided to you guys 5 different handouts. And of the 5, I've put 3 of them up on the screen because these are the 3 that are going to be most important for our content today. So on the left-hand side of the screen, you see what we just kind of call our webinar guide. So if I could give you one piece of paper that was front and back that kind of summarizes today's presentation, that's it. So it's going to be a little bit about the overview of BPH, some statistical information, some of the etiology behind it, what herbs we might consider, a couple formulations. So just a one-stop shop, what we would call webinar guide, to get you guys some of that information as a takeaway. So that's something that's really important, again, to me as a practitioner. When I would travel to these seminars and symposiums, I love handouts. I love sample protocols. I love when we talk about treatment strategy. So that's why I think it's so important for us to give that out to you guys, whether it's in our courses or whether it's just a 1-hour webinar today for you guys. So that is on the left-hand side, webinar guide. We'll talk about that a little bit throughout the presentation, but we'll also be able to pull that and use that during video 1, which I'll share with you in just a couple moments. The next handout that I think is going to be very applicable for you is the International Prostate Symptom Score. One of the things that I think is going to be important for practitioners to use this information and implement it in practice are assessment tools. So if this is a segment of your practice that you do see men that struggle with BPH, enlarged prostate, or any sort of prostate issues, this is a great tool, an assessment tool for you guys to give to them, have them fill it out. I tend to notice that our men in practice aren't really great with giving too many details. They're not as forthcoming with sharing as many symptoms as I would like to see fit in an assessment. So having a physical piece of paper, a tool that is based on 7 questions, they can handle that. So this is something that we have as 2 different forms or 2 different versions for you. What you see there, this is a PDF version. You can print that and start using that in practice right away. The second version that I've included for you guys is actually a Word document format. And the reason we like to do the Word document format is so that you guys can actually put your office information in there. If you want to brand this and make it your own and you want to put your office logo or your information or your address or the website, how they can, contact you, you have our full permission to take this and fully make it your own. I really believe, again, as a practitioner, I really believe that we need those tools and that we need to support each other and being able to share what works and also to collect both subjective as objective data. So if you're really heavy on functional blood chemistry, you can layer a piece of assessment tool like this and be able to get both subjective and objective. And I think having both pieces of data and information will give you a better foundation of building a treatment strategy or maybe selecting a particular product that may differentiate why you would use one versus another. But also it's great to document. It is so important that we document before and afters. So again, this is I think a real value add in today. Hopefully you guys find this very valuable. This is a tool that is actually used in white papers. So when you're reading research about BPH and treatments that are effective or not clinically effective, they are oftentimes using this exact tool. It might look a little different, but this is the one that we've recreated for you guys again to use in practice. And the third and final resource that I want to highlight for you guys today are, of course, the notes. So we are going to get into, we've got 2 different videos for you today. The second video is the longer video with lots of slides, and it's really going to highlight and talk about the herbs that are going to be supportive to your patients, your clients who are struggling with benign prostatic hypertrophy. So that's going to be the bulk of the content today, is the herbs and If I can just highlight real quick, one more thing is that when we discuss herbs, we're discussing them very often in a Western herbal therapy or Western herbal medicine environment. So you'll understand this when you see Lee speaking in just a moment. But Lee, when we bring to you this content, we want to make sure that it's not just about herbal traditions. So although we've got things like Eastern medicine, traditional Chinese medicine, TCM, and so on, it's important to blend old world with new world. So I think that's one of the beauties about this type of information, is being able to bring to you the content, the herb itself, how it's been used in tradition. That's very important, but also how we're being able to show that in clinic and practice, it's being backed up by research that can be reproduced by us, the end users and the patients. So you will have lots of notes today. That's going to be your notes handouts. Hopefully you have had an opportunity to print those out. This presentation is also being recorded, as Kaylee alluded to earlier, so that you guys have this, you can rewatch it again and hopefully take as many notes as you need. So with that all being said, and we've discussed some of those resources, let's go ahead and get into video 1. So we've got 2 videos for you today. This first video is actually going to be introducing you to Lee Carroll. The reason we have a video is because Lee is joining us from Brisbane, Australia. And at this time, it is exactly 5:13 a.m. in Brisbane, Australia. So we're going to let Lee sleep in a little bit. We recorded this video for you guys last week. He's going to introduce himself for about 1 to 2 minutes, a little bit about how he got started in Western herbal medicine, and his understanding what really drove his passion to do this on a day in, day out basis. His clinic is located in Brisbane, Australia, and he's also going to give us a great overview into benign prostatic hypertrophy. So in this first video, which is about 10 or 11 minutes, you're going to use this first handout, which is what you see on the screen. We just discussed this on the previous slide. So this is the webinar guide. I've got mine printed here with you guys as well. And so this is just, again, an overview. You're welcome to take some notes here, but we did a pretty good job trying to piece all of what's going to be said in that first 10-minute video onto this handout. So you're welcome, again, to take notes there. The other thing is he is going to discuss a little bit about the International Prostate Symptom Score. IPSS is how that's abbreviated. So these are the 2 resources that you'll be able to use with this first video. So without further ado, let's go ahead and get started. And I'm going to click play in just a moment. So please enjoy.
Hello, good afternoon, and thank you for your interest in my Functional Herbal Therapy program. If I was doing this live, it'd be 5 a.m. here in Brisbane, Australia, hence the video. I've been working with herbal medicine for 30 years now, and I've had the good fortune to work with some of the world's best companies and the world's brightest minds, notably MediHerb and Professor Kerry Bone. I started out as MediHerb's first production manager way back in 1990 and subsequently held senior positions in the operational side of the business, including quality assurance and research and development. In 2001, I had the opportunity to relocate my family to the US to develop the MediHerb business there, and was based at Standard Process and lived in Madison, Wisconsin. During my 8 years in the US, I took on the role of herbal educator for MediHerb, and I travelled extensively throughout the US lecturing, teaching and mentoring practitioners. It was during these years that I had the realisation that I was living my dream and herbal medicine was my bliss. On my return to Australia, I went back to college and gained a degree in health science with a major in Western herbal medicine. I received the Academic Medal of Excellence as the top student in the graduating year. Since 2013, I've been in private practice as a medical herbalist, and I continue to teach and educate. The Functional Herbal Therapy program is a distillation of all that I've learned in my 30 years experience, deeply immersed in the world of herbal medicine. And it's a reflection of the close relationship with Kerry Bone and his influence and his mentorship. My approach to practicing and teaching Western herbal medicine sits at the intersection between traditional knowledge, contemporary biomedical science, research, and clinical practice. This is the essence of functional herbal therapy. As an introduction to my functional herbal therapy program, I'd like to use the example of BPH from the male endocrine module. I will provide a brief intro and then I'll play a video from the module which discusses the key herbs used for this condition. Benign prostatic hyperplasia, BPH, is the most common benign proliferative disease in aging men, with a prevalence in the 40 to 50 age group of 42%, above 50 about 50%, and up to 90% in men over the age of 80 years old. BPH is a nodular and often multinodular hyperplasia that affects stromal and epithelial cells in the prostate, particularly in the zones that are referred to as the transitional and the periurethral zones. This results in varying degrees of obstruction to both the bladder outlet and the prostatic urethra, and patients can have this with or without symptoms. BPH causes obstruction by either compression and/or distortion, depending on the position of the nodules. Distortion, or technically bending, of the bladder neck has a greater impact on flow than compression does on the urethra. Using a garden hose analogy, it's easier to shut off the flow by bending rather than compressing the hose. So the position of the nodule can have a greater impact than the size of the nodule. If the obstruction is severe, then BPH may eventually cause harm to the bladder and the kidneys. So where there's significant issues, we need to take urgent action. BPH progresses slowly, which provides us ample opportunity for effective herbal treatment. However, the challenge is getting the men to seek out treatment early enough in the disease cycle. BPH symptoms can be divided roughly into two categories: storage symptoms and voiding symptoms. And many of us are familiar with these: increased frequency, getting up in the night to urinate, hesitancy, urgency, reduced flow, incomplete emptying, etc. These symptoms can also relate to changes in bladder connective tissue and muscle tone, as well as fibrosis that occurs at the bladder outlet. This is especially significant in older men, and it needs to be considered when developing a treatment strategy. In terms of decreased quality of life, BPH is the most dramatic and organic manifestation of late onset hypogonadism. Many of us call that andropause. This is discussed in detail earlier in Module 19 and introduces herbs which support male endocrine function, notably tribulus and ashwagandha. Clinically, BPH is defined as having at least two of the following: moderate to severe lower urinary tract symptoms with an International Prostate Score above 8, an enlarged prostate with a volume greater than 30 mils, and decreased flow with a flow rate less than 15 millilitres per second. The International Prostate Symptom Score has 7 questions which relate to the previous month's symptoms: incomplete emptying, frequency, intermittency, urgency, weak stream, straining, and nocturia. Each of these questions is scored from 0 to 5, and a score between 1 and 7 is considered mild, between 8 and 19 is moderate, and between 20 and 35 is severe. However, the male patients typically arrive with a BPH diagnosis, so the true benefit of this symptom survey or score is to monitor the patient's progress once we get them onto a well-developed herbal and nutritional program. So to understand how we're going to tackle a patient with BPH and develop an individualized treatment strategy and program, we need to have a good understanding of what the causes are. And with BPH, the causes aren't exactly known, but there are various theories. Age is obviously a factor, so as men age, we need to be considering introducing prostate tonics into their programs. The recent research downplays androgens. Both testosterone and dihydrotestosterone are considered now to be permissive. A higher estrogen to testosterone ratio could be a causative hormonal factor. Increased peripheral conversion of testosterone to estradiol could also be at play. I think this is quite a significant feature. Chronic inflammation is also a very common finding, and we may see increases in C-reactive protein and various growth factors if we're looking at those things on labs. And chronic inflammation is also associated with the fibrosis, which I mentioned earlier, that occurs at the bladder outlet. One theory has proposed that BPH is an immune-mediated inflammatory disease caused by either infection or autoimmunity. Definitely there is a strong link between chronic prostatitis, both bacterial and viral in origin, and the development of BPH later in life. Circulating levels of insulin may be a factor, and also metabolic syndrome, non-alcoholic fatty liver disease, obesity, decreased physical activity, smoking, and a high-protein diet are all implicated through various scientific research publications. Perhaps a way of understanding how all of this comes together is our understanding now of the role of estrogen, which is perhaps a unifying feature. Prostate tissues express estrogen receptors based on the health and inflammatory environment of the prostate. So both estrogen alpha and estrogen beta receptors can be expressed. So where there's greater levels of inflammation and distress, there's greater expression of estrogen alpha receptors, particularly in the stroma and the epithelium. And when these receptors are activated, they have a proliferative effect. Estrogen receptor beta, which is found in the epithelium, has an anti-proliferative effect. So our phytoestrogenic herbs can play a role at blocking estrogen receptor alpha and activating receptor beta at those tissues. And in the research that's been conducted, relatively recent research from 2017-2018, patients with lower urinary tract symptoms who underwent transurethral resection of the prostate were found to have significantly increased levels of estrogen alpha compared to healthy controls. And the estrogen alpha was correlated with elevated scores on the IPSS, total prostate volume, and also post-void residual volume. So estrogen alpha may perhaps be a key mediator of BPH and lower urinary tract symptoms. There's also a dynamic component to BPH. Increased sympathetic activity can cause contraction both of the bladder neck and the prostatic urethra, and the alpha adrenergic receptors play a crucial role in this symptomatology. In fact, tamsulosin, or Flomax, is an agonist of these receptors and used to treat BPH quite effectively. Sympathetic tone can be variable, which explains why symptoms can vary in severity at any given time for men with BPH. So clinically, we need to place emphasis on supporting the nervous system, and this is often overlooked. Key herbs in this area are smooth muscle relaxing herbs. Notably, cramp bark does a wonderful job. The hepatorenal reflex may also be involved, and this links metabolic syndrome, fatty liver, and elevated uric acid to increased sympathetic tone as well as increased blood pressure. So with that as a background to BPH, I'd now like to invite you to watch one of the videos from the male hormone module, which describes the key herbs that can provide benefit for patients with BPH. I hope you enjoy it. Thank you. Hi, and welcome back to video 5 of module 19. So in this video, we're talking about the herbs, the key herbs for BPH. And as with the other aspects of male health, it's only a small number of herbs that we're choosing from for BPH. Saw palmetto, nettle root, and crotava make up the backbone of the treatment of BPH. So let's talk initially about saw palmetto, or Serenoa repens. So this is a lovely photograph taken in Florida where saw palmetto is native. And the Native Americans used to use the fruit as a medicine and also a food, and the early herbalists in North America learned about it from the Native Americans. And the fruit's got an unusually sweet, rancid kind of taste. So if you haven't tasted saw palmetto, it's an interesting experience when you first do that. So saw palmetto is the key herb for BPH, and it's considered to be a male tonic, although I'm using it in clinic almost exclusively for dealing with BPH. It's probably not a strong 5-alpha reductase inhibitor. We don't really know how it's exerting its full effects. It may be involved in lowering prolactin, but equally, based on the discussion we had with estrogen earlier, it may be modulating estrogen activity. What we do know is that saw palmetto works incredibly well, particularly when you combine it with other herbs like nettle root. So the Cochrane collaboration systematic review and meta-analysis that was conducted in 2009 concluded that saw palmetto was no better than placebo. And when you read about saw palmetto in the popular press, you know, this gets quoted as being the reason why you shouldn't bother using it because it's no good. But when you look into the data, you know, there's been a lot of clinical investigation of saw palmetto, and the reason that negative review was written was because they included a large study which used a different quality material than had been used in all of the previous studies. So it was quite likely that the negative outcome of that one large study was bogus because the quality wasn't good. If you take that study out and look at the remaining 14 trials that enrolled over 4,000 patients, then the conclusions are quite positive. And the defining features of regular consumption of saw palmetto are decreasing nocturia, so you know, getting up in the night to urinate, decreasing in the prostate scores, and an increase in the flow rate. They're the key features that stand out in a clinical study. And my own clinical experience is, you know, with patients, the nocturia is one of the first things that patients say gives them relief. And I've had patients that have been getting up 3 and 4 times a night, and within a couple of months they can sleep all the way through. And that is a significant feature of improvement in BPH, but just having that sleep has a significant impact on the quality of life of that patient as well. This type of treatment needs to be long-term. So, you know, if you ask me, you know, how long should I be on this good diet for, I would say, well, for the rest of your life. So in certain situations, and particularly in the situation of BPH, men that have got this issue need to be taking herbs for a very long period of time, just like they have to have a good diet and a good exercise routine. So this study is quite interesting. Even though it's an open study, it's not the double-blind placebo-controlled gold standard, but it was conducted over 15 years, and it reflects true life. This is how we do it in a clinical setting. So if you give patients just a moderate dose of saw palmetto extract, 320 milligrams is very easily achievable as a tablet or as a capsule. There's a significant improvement in their prostate volume, in their urination rate, in their residual volume, and improvements in their IPSS scores and their quality of life measurements. So saw palmetto is really indispensable in this category. Very often men will have bacterial prostatitis, and that sets the scene for them to have increased rates of BPH. So in this relatively recent study, it was looking at the effect of saw palmetto in patients that had a type of chronic bacterial prostatitis, which is normally treated with antibiotics. So type 1 bacterial prostatitis is acute, and type 2 is chronic. And it may have symptoms or it may not, but it's very commonly treated with antibiotics. So the groups were divided up as antibiotic only and antibiotic along with saw palmetto. Again, a real life scenario. So this study showed that patients that took the antibiotic along with the saw palmetto, and there was some bearberry and also a probiotic supplement, like all packaged together, that the recurrence rates were significantly higher for the antibiotic treatment group alone. So combining the herb and the drug together gave a better outcome. And there was in group B, so the antibiotic and the saw palmetto, there was statistically significant improvements in the symptoms and also in serum PSA. So PSA is a measure of prostatic inflammation as well as cancer in that setting. So combining saw palmetto along with conventional therapies plays an important role as well. So nettle, Urtica dioica, we typically think about using the leaf, and the leaf that you're looking at here is used as a mild depurative. It's used for skin conditions, particularly where there's itchy skin. But the root of the nettle, in this case, is very highly specific to the prostate. And many herbs have got multiple actions, but the nettle root only has one action, and that is being anti-prostatic. So it helps to correct the negative influences that cause the development of the BPH. And when you look at the randomized controlled trials, there's a decrease in the International Prostate Score, there's a decrease in post-void residual volume, and that therefore leads to a decrease in urinary tract infections. And the effects of nettle root, we're not fully aware of how it works, but it may be because it is normalizing sex hormone binding globulin. It may be to do with epidermal growth factors and prostate steroid membrane receptors. It's unlikely that it's a 5-alpha reductase inhibitor. And as we were talking about with saw palmetto, perhaps there's an estrogenic involvement as well. Whichever way we look at it, as long as we've got a good quality nettle root extract, and it's been used in clinical trials and in clinic traditionally in Europe for a very long time, and we understand the quality characteristics, if we get a good quality product, it will do a good job. So in this study, there were approaching 600 men with lower urinary tract symptoms that were due to BPH, and they were given nettle root over a period of 6 months. The dose, quite easily achievable, 120 milligrams 3 times a day, so it approximates around 2 grams of herb, which is quite easy to get. These patients were enrolled in the study if they had elevated IPSS scores. So when they looked at the outcome after the 6-month trial, there were significant improvements in the lower urinary tract symptoms. So the IPSS scores started off at around 20, and 20 is the cutoff between moderate and severe. So the high end of moderate is 19 and severe starts from 20. So their score went from 20, it halved almost down to 11.8, and that was statistically significant, whereas the placebo group went from 19.2 down to 17.7. The flow rate improved, and that was measured as milliliters per second. The post-void residual volume improved, and that was measured in milliliters. And the prostatic volume significantly decreased as well, and that was measured as cubic centimeters. There were no changes detected in serum PSA or testosterone, and after 18-month follow-up, only the nettle group showed improvements. So nettle root combines very nicely with saw palmetto, and the idea is that these herbs get taken over a very long period of time. They become just part of a daily routine. So in this next study, the two herbs are combined together at those similar types of doses. So There are 140 elderly men with lower urinary tract symptoms, and this study was conducted over 60 weeks, so just over a year, with clinically relevant and easily achievable levels of saw palmetto and nettle root. So they were Group A, and Group B was tamsulosin, which is an alpha adrenergic antagonist, and Flomax is one of the more common brand names associated with that drug. So in the herbal group, their IPSS score was 20 plus or minus 4, and in the drug group it was 21 plus or minus 4. So they were quite well matched in terms of their symptoms. Both groups reduced their IPSS score by about 9 points. So the most common reduction was 9 points. So the herbs work just as well as the drug. And when you look at patients that responded very positively, there was a 32% of the group taking the herbs and only 28% of the group taking the drug. So the herbs had a better response rate. If we graph this, we can see a decrease over the 60 weeks. So this is time in weeks across the bottom, and the IPSS scores vertically. So you can see the active and the placebo track very closely together and significantly decrease over the course of that time. So we're seeing a halving of their prostate scores, which gets them from the moderate category to the mild category of their symptoms. In terms of patient outcomes, if a patient experiences this, they're incredibly happy with the outcomes. And then Crotava nivala is an Ayurvedic herb. So you're looking at the flower and the leaf, but the plant part that we use in the clinic is the bark of the tree. And it's an Ayurvedic herb. It was one of the most important Ayurvedic herbs that has an influence over the urinary tract. And it was used traditionally for things like cystitis and kidney and bladder stones. It's got some significant anti-lithic properties. It was used for incontinence and bedwetting. So this is a synergistic partner, if you like, that would combine very nicely with the saw palmetto and the nettle root. So the purpose of talking about Crotava within the BPH category is that it supports the bladder function and the tone of the muscles within the bladder. So it supports urinary frequency, it supports the nocturia and the urgency and the incontinence associated with BPH. I'll be talking more about Crotava in the kidney module, which is coming up. There's very little research around Crotava. There's lots of traditional knowledge, and the one study that I'm quoting here, there were 30 patients with a hypotonic bladder due to BPH. So as the prostate starts to impact on the bladder muscle, it can't compress effectively, which leads to the symptoms. So just taking Crotava, and in these traditional settings, Crotava's boiled up and consumed as a decoction. There was a marked improvement in frequency, in incontinence, in pain, retention, urinary flow improved as well. So I use Crotava in clinic, and I use it as a single herb in combination with these other herbs as well. And my most recent experience was with a patient that had an issue with a viral infection in their brain, which damaged the nerves that fed their bladder. So they had to use a catheter to urinate, and their medical doctor said that they'd forever have to use a catheter. Their bladder wouldn't work again. And just taking Crotava over a period of 6 months got that patient to the point where they only needed to use the catheter once in the evening and not use it at all during the day. So they went from using a catheter constantly just to using it once at night. And crotave is a significant herb for tonifying and tropho-restoring, if you like, all of the tissues around the bladder and the urinary tract. Another herb or food which pops up on the radar for BPH is pumpkin seeds. And pumpkin seeds, particularly as an oil, have a tonic effect on the bladder, and they have a relaxing effect on the sphincters of the bladder neck and also the prostatic urethra. There's been a number of clinical studies that demonstrate improvements in the IPSS score and urinary flow parameters and quality of life just eating pumpkin seeds. So pumpkin seeds as part of the diet and also part of a supplemental program as the oil play an important role. And it's the steroidal chemistry in the oils, particularly the delta-7 sterols, that play an important role in this process. And then, because I talked about estrogens earlier, when I started to read the research, I was quite interested to see that tribulus has been used for BPH traditionally. So much of the tradition is around fruit, but in these couple of studies, tribulus leaf was used in combinations with other herbs to give a significant improvement in lowering the IPSS scores. So tribulus, I suspect, because of its estrogenic properties, is helping to calm down the impact at the estrogen alpha receptor. So we don't fully understand how this works, but if tribulus has got the ability to weakly bind to estrogen receptors, but only very weakly stimulate them, we can effectively block those receptors from receiving the signals from the estrogens that are present in the environment. If tribulus also increases testosterone, then we can improve the net equation of estrogen dominance and get a patient back to a normal balance of estrogen being in the minority and testosterone being dominant. So tribulus performs well in conjunction with other herbs. So we could use tribulus to treat the LOH, the late onset hypogonadal symptoms of the BPH patient, but it may in fact be having a direct impact on the prostate itself. So perhaps we could experiment with herbs like shatavari, which is what we talked about in the female module, or herbs like wild yam again. So if we're looking for extra options, then perhaps that would be the way to experiment. But the key herbs for prostate health are the saw palmetto, the nettle root, and the crotava, and we could even combine them with pumpkin seed oil. So I didn't put a daily range on these herbs because typically I don't recommend a daily range. That these doses that I'm recommending here are the doses that every patient gets. So approximately 2 grams of nettle root, approximately 3 grams of saw palmetto, and approximately 3 grams of crotava bark. And if they're in a synergistic formulation, over a period of 2 to 3 months, we see significant improvements in our patients' health. So the core therapy are those 3 key herbs, and very often that's all you need to use. And when we're talking about treatments that need to span, very long periods of time, they need to be simple and they need to be cost effective. So the additional support comes in the early stages of treatment. So the cramp bark, the corydalis, the wild yam, to relax the smooth muscle. Once we get control of that dynamic component, and the saw palmetto will help that, then the patient doesn't need to take it long term. The tribulus comes in where there's low testosterone, and we get that added benefit at the prostate, and that might be a long-term herb when we're focusing on improving the issues around low testosterone. The fibrosis is likely to play an important role when there's reduced stream and obstruction in the urethra. So gotu kola taken over the course of a long period of time, from 6 months up to a couple of years, it can prevent the development of fibrotic tissue, and in terms of that viewing that as a type of scar, it can actually remodel that tissue so you could take away some of the volume. So gotu kola over the course of a long treatment may improve the direct physical symptoms associated with a narrowing of the urethra. And then we need to consider the herbs that support urinary tract and bladder infections particularly. So cranberry, buku and uva ursi or bearberry play an important role. And along with those herbs, we need to be using immune herbs like echinacea and andrographis that we talked about in Module 8. Additional herbs that you could use to support the dynamic component, the valerian and passion flower type of combinations that we use for anxiety and sleep. Kava may also play a role. And then we need to manage, any of the symptoms that present. So, depression, sleep deprivation, metabolic syndrome. These are quite common features of these patients. And then I typically get them to eat pumpkin seeds, a small handful a day as a snack. I get them to eat Brazil nuts as a source of selenium, and selenium plays an important role in the oxidative defensive mechanisms in the prostate. And flax seeds, if the patient's taking a shake in the morning as part of their dietary program, some good quality flax seeds, a 1/2 to 1 ounce in the shake ground up, play an important role as well. And interestingly, they're significantly estrogenic and may impact on estrogen receptor alpha at the prostate. And then in terms of urination technique, we need to give our patients some advice based on this relatively recent clinical study, which was a systematic review of 11 different studies of men with lower urinary tract symptoms. And in this study, they looked at sitting position in terms of the benefits with urination. And what they found was that men with BPH and lower urinary tract symptoms, if they urinate sitting down, there's a significant decrease in the post-void residual volume of 25 mils, which is incredibly significant. That's the sort of decrease that you get taking drugs and herbs. That means that there'll be less incidence of urinary tract infections. Sitting down, urinating also increases the maximum urinary flow rates, and it decreases the voiding time. And when men sit down, there are no differences in these parameters. So any of the patients that fit this characteristic, recommend to them that they need to be changing their urination habits and sit down rather than standing up. So that brings us to the end of this module and this video. So the final task is to read the relevant sections of the Saul Palmetto monograph, which is found on pages 804 through 815 in the Principles and Practice of Phytotherapy. And I'll look forward to seeing you on module 20 when we're talking about cardiovascular health. Thank you.
Okay, that was awesome. I'm going to just pass the presenter back to you, Jen, so you can bring up some.
Thank you.
Your slides. Just give me a sec.
There's always a little technology lag when we switch from screens to, yes, absolutely. So we're picking back up off of the video 2 introduction here. So that was an overview and introduction for you guys into the course of what it looks like to go through and experience a video as you guys are going into the courses there. So, and at the very end on the slide, the last slide, if you know, or noticed that Lee Carroll gave you guys some homework. So there is a book that correlates with the course of the program called The Practice and Principles of Phytotherapy. And that's something that is written by Professor Carrie Bone and Simon Mills. And it's a fantastic textbook to guide you through understanding, learning, and implementing Western herbal medicine into practice. So that's something at the very end of every video. There's recommended reading where you can learn more. So that was video 2. So we're right on time, guys, just kind of wrapping up for this presentation today. And I have just a few more slides for you guys. And I didn't see any questions coming through, so I'm not sure if I just am looking in the wrong spot, but hopefully you guys have a couple questions that we may be able to send over to Lee. And just as a reminder for you guys to learn more, this is our website, sownutritionalsystems.com. You'll learn more about our core courses, our advanced courses, virtual seminars, and so on. And one of the things that we like to offer for you guys is if you do want to see another sample video, I think it's really important before you jump on into a course that you have an opportunity to see and experience a little bit about it before you make any time of commitment, financial or time or anything like that. But there's a website here where you guys can get another sample video. So today we played a video from module 19, which is male endocrine. So I went ahead and picked a different one for you guys. When you go to that website, this is what it looks like on the right-hand side here for you. And this is actually from module 3. This is one of my favorite modules, and it's early on. It's called Phytochemicals as Cellular and Metabolic Regulators. And in this particular video that you guys are going to get a sample of, Lee discusses NRF2. And so I think this module was so important for me as a practitioner to look at herbs differently. Herbs, it's not just about herbal tea. This is really about looking at herbs as it plays a role in everyday life, that we need to look at them as vitamins, minerals, water, herbs. It's that important that it should be a makeup of our micronutrients within our dietary aspects of what we do. But also looking at this, that they can have really powerful, clinically valuable effects on our body with fantastic outcomes, even at a cellular level. So I think you guys will enjoy this one. I love learning about NRF2 and how food and herbs help to impact this really powerful, important process that happens at a cellular level. So that's the other sample. If you guys would like to get that sample video, you just go to the website that was listed previously there. And for those of you who are interested in the course, one of the 5th handout that I did add into your guys' information was about the course itself. There's 24 different modules. There's over 121 videos. Each video is about 20 to 25 minutes, so that they're bite-sized chunks where you guys can learn. You can watch as many or as little as you want. You can sneak in one during your lunch hour or watch it when you get home from work, or you can spend a weekend and just go through a few modules. So the course is $19.97, and as you guys spending your day or your afternoon with us here, we always like to offer a bit of a discount. So Fullscript 400 will take off $400, which is 20% of that total. There is a monthly payment option if you guys would rather go that route. I just want to highlight real quick the difference between the two. If you want to go through this program very quickly, or if you want to bounce around from module to module, I recommend that you buy it all at once so that we can release the content to you all at once. If you want to just follow along as a traditional course, each month you can get 2 released, and I'll let you guys decide what's best for you. But I also want to highlight that if you purchase this program, this is yours forever. You have the ability to watch it and go back to it as many times as you'd like. That was really important to us as a practitioner. I want to make sure you guys have the opportunity to say, hey, I have a tough kidney case coming in. Oh, I need to jump over to module 22 and review some of those videos. So I'm really keen and up to date on what herbs I can consider when developing a treatment plan. So that's something that we want this to be a resource. We've got hundreds of handouts, for treatment guides. We've got different supplement formulation considerations and so on. So I really encourage you guys to take a look at that. And just one more last picture. This is when you get to SOW Nutritional Systems. I know it's a long name, but when you get there, you know you're in the right place when the screen looks just like this. So that is my last slide, and I'm going to very gratefully and humbly turn this back over to Kaylee and Fullscript. And I just want to say thank you so much for your time, guys. I hope you learned some little clinical pearls from Lee's videos. And I also hope that you have some value in those handouts that you've been able to get and start using those with your patients. So again, thank you so much. And I will turn this back over to you, Kaylee.
Hi. All right. Can you hear me?
I can hear you now. Yes.
We lost audio, so I don't know if it was just me or if we lost a bit of just the ending of like the last little bits of what you were saying. So
Okay.
I apologize to everyone for that. I'm not exactly sure. Honestly, it's never happened. So the joys of the pandemic, working from home webinars, but
Yes.
we are kind of close to time. There are a few questions that have come through. Mostly I think it's actually in like the questions drop down of the control panel, not the chat on the organizer side. So I should have mentioned that. It's a little different, and a bunch of them just came in at the end here. So I've been kind of keeping an eye, and I think maybe most of them might be for Lee. And as you said, we have access to Lee all the way in Australia, you said he is, right? And
Absolutely.
he will be able to send him these questions in a report kind of format, and he's going to answer them for us, and we'll provide the answers along with the questions as well to as part of the package as the resource kind of follow up. I know there was a couple questions on dosage, but I think he went through that in his presentation as well, but maybe he can give a little more context.
Awesome.
Interactions with using some of the herbs with pharmaceuticals was a question I think I saw come in. So I know we want to be conscious of time, so maybe we will save those in a report and send them out with the follow-up. As I said, you'll receive the recording, you will receive all these extra goodies. I'm really excited to provide attendees and registrants with all the handouts that Jen has provided today. And a recording will come out in the next day or so once we can get it all organized. But I want to thank you for being here today. It was awesome. I learned a lot. I'm really excited for this new educational partnership, and I'm really hoping we can do more of these in the future.
Absolutely. It's all about the calendar, girl. We just got to get those scheduled, and we'll see you guys all hopefully in the future again. But I appreciate your guys' questions. I was only able to click through just a couple, but I'll make sure that those get out to Lee. When it comes to pharmacokinetics and how herbs interact with drugs, you have to be real careful, especially with Western herbal medicine, because what these formulas are put together at a very high therapeutic level. In Australia, where a lot of the herbs that I use come from, they are pharmaceutical grade. So you absolutely have to look at that and take the time to do the research and so on. So I'll see if we can get a couple tools or something that would be additional value there. So yeah, thank you again.
Yeah, okay, great. And I was gonna also mention too, if sometimes emails come into spam. I know we're getting a lot lately, so if you don't see the email come through for the follow-up, you can always find all the information, all the webinars on the Fullscript website at fullscript.com/webinars. And any more questions too, you can email me. Right now, you can email me at webinars@fullscript.com, and I can either help answer or pass them along maybe to Jen and Lee if possible, because I probably can't answer them. So, but that being said, again, thank you guys all for attending, and thank you, Jen, and we hope to do this again in the future.
Absolutely. Take care, guys. Happy Thursday.